Okay, so let's dive right into this stack of articles you sent me about AI medical scribes.
Yeah.
It's pretty timely, don't you think? They're popping up everywhere.
Yeah, they're definitely getting a lot of attention, and for good reason.
We've got articles here from tech companies, medical journals.
Mm-hmm.
Even Apple seems to be dipping their toes into the water here.
It's really interesting.
It's clear that something big is happening.
Yeah.
So let's try to unpack it and figure out what it all means for you, the patient,
Yeah.
and for the doctors on the front lines.
Right.
So what exactly are these AI scribes doing? I mean, I get the basic idea
Yeah.
of transcribing doctor-patient conversations, but what else is there?
That's a great question.
Yeah.
While transcription is certainly a key part of it,
Right.
it's really just the tip of the iceberg.
Okay.
What's really interesting is how AI scribes are going way beyond simple dictation
Mm-hmm.
and becoming more like intelligent assistants for doctors.
Okay.
Take Nabla, for example. They're generating notes in real time, like 20 seconds.
20 seconds. Really?
Yeah.
That's faster than I can order a pizza.
Yeah, it's pretty remarkable, right?
It is.
They're using advanced natural language processing and machine learning algorithms to analyze the conversation in real time
Yeah.
and pull out the most relevant information.
Got it.
And it's not just about speed either.
Okay.
They're also getting really good at suggesting medical codes for billing, which is a huge pain point for doctors.
So they're streamlining all that administrative work?
Exactly.
That has to be a relief for doctors. I mean,
Oh,
I've
yeah.
definitely experienced those long wait times, and I always assumed it was because doctors were just swamped with paperwork.
Yeah, you're absolutely right. AI scribes can free up a significant amount of time for doctors, allowing them to see more patients or spend more time with the patients they have.
Okay.
And some AI scribes are even going beyond the traditional doctor's office visit
Oh, wow.
and helping to manage chronic conditions through things like chatbots and voice notes.
So you're telling me I could potentially have a conversation with my doctor's AI assistant even when the office is closed?
That's right.
That's fascinating. Is that something that's widely available already?
It's still early days, but companies like Nabla are definitely pushing in that direction.
Okay.
This asynchronous care, as it's called, could be a game changer for managing chronic conditions and ensuring patients get the support they need when they need it.
That's really interesting.
Yeah.
Okay, so we've got AI scribes helping with notes, billing, even patient communication.
Right?
It sounds like there are a lot of different players in this field.
Yeah, there are.
Can you walk us through who some of the key companies are?
Absolutely. You've got your established players like Nuance, the company behind Dragon, naturally speaking,
Okay.
which has been a leader in voice recognition for years.
Dragon, naturally speaking, I remember using that back in the day.
Right.
It's amazing to see how far that technology has come.
It really is. And then you have newer companies like Nabla, who we've already talked about, and others like DeepScribe and Ambience.
Okay.
They're all approaching AI scribes in slightly different ways, which makes it even more interesting.
All right.
DeepScribe, for instance, incorporates human review into their process for an extra layer of quality control.
So it's not a purely AI-driven system.
That's right.
There's still a human element involved. That's reassuring, especially when it comes to something as important as medical records.
Yeah, I think so.
What about Ambience? What makes them stand out?
Ambience is taking a really interesting approach. They're focusing on helping doctors adapt to value-based care models.
Value-based care models. I'm not familiar with that. What does that mean exactly?
It's a shift in healthcare towards rewarding doctors for the quality of care they provide, rather than just the number of patients they see.
Okay.
Ambience is using AI to help doctors track quality measures and improve outcomes,
Got it.
which is a big deal for you, the patient.
Mm-hmm.
It means you're more likely to receive care that's tailored to your individual needs and focused on getting you the best possible results.
That makes a lot of sense. It seems like there's a real emphasis on making healthcare more personalized and patient-centered.
Absolutely.
So with all these different companies and approaches, it sounds like the cost of these AI scribes could vary quite a bit.
You're right.
What kind of price range are we looking at?
The pricing can vary widely depending on the company and the specific features offered.
Okay.
Nabla, for instance, is known for being quite affordable, coming in at around $119 per month.
Wow.
On the other hand, Nuance's DAX system, with its more advanced features and integration capabilities, can cost upwards of $600 per month.
Wow. That's a pretty big difference.
Yeah.
It makes you wonder what those extra dollars are getting you right.
It's a good question.
Is it just a matter of more bells and whistles, or is there a real difference in the quality of the service?
Some of the higher-priced options might offer more sophisticated features like integration with existing electronic health record systems or more advanced analytics capabilities. But ultimately, the best choice for a particular doctor or practice will depend on their specific needs and budget.
Right. It's not a one-size-fits-all situation. There's a lot to consider.
Definitely.
But let's focus on what really matters.
Hmm.
What are the potential benefits for doctors, and most importantly for you, the patient?
Hmm.
We've touched on some of them already, but I'd love to hear more about how AI scribes could really change the healthcare experience for the better.
Well, one of the most obvious benefits is the time savings for doctors.
Right.
We've talked about how AI scribes can handle a lot of the administrative work, like note-taking and billing, freeing up doctors to spend more time with their patients.
And that's a huge deal, right? I
Yeah.
mean, I've definitely felt rushed during appointments before, like, the doctor was trying to get to the next patient as quickly as possible.
It's a common experience, unfortunately.
Yeah.
But imagine walking into an appointment and your doctor is actually able to sit down with you, make eye contact, and really listen to your concerns without constantly being interrupted by paperwork or computer screens.
That would be a game changer.
Yeah,
It makes you feel like you're being heard and that your health concerns are truly being taken seriously.
exactly. AI scribes have the potential to make healthcare feel more human again, more personal, more like a partnership between doctor and patient.
I love that. A partnership
Yeah.
between doctor and patient.
Yeah,
It shouldn't feel like a transaction. It should feel like a collaboration.
absolutely. And AI scribes can facilitate that collaboration by giving doctors the time and space to really connect with their patients.
I see.
But it's not just about the doctor-patient relationship.
Okay.
AI scribes can also improve the quality of care itself.
How so?
Well, for one thing, by taking over those tedious administrative tasks, AI scribes can help reduce burnout among doctors.
Right.
And a less stressed, less burnt out doctor is more likely to provide attentive and compassionate care.
Burnout is a huge problem in healthcare.
Yeah, it's a real crisis.
I've heard stories about doctors working incredibly long hours and feeling overwhelmed by the demands of their job.
And it's affecting the quality of care patients are receiving.
Wow.
But if AI scribes can help alleviate some of that burden, it could make a big difference in doctor morale and patient satisfaction.
So it's a win-win situation.
That's right.
Doctors are happier and patients receive better care. It sounds almost too good to be true.
It does sound promising, doesn't it? But as with any new technology, there are always potential challenges and considerations.
Right.
And one of the big ones, especially when it comes to healthcare, is privacy.
Yeah, that's a great question. I'm glad you brought that up.
We're dealing with very sensitive information here.
Right.
So how do these AI scribes ensure that patient data is kept confidential and secure?
That's something I've been wondering about as well. What kind of safeguards are in place to protect patient privacy in this new AI-driven world?
Well, different companies are taking different approaches to data privacy, but it's definitely a top priority for most of them.
Okay.
Some companies like Zabla are even claiming to never store user data, which is quite remarkable.
Never. That's impressive.
Right.
But how do they train their AI models if they're not storing any data? I'm curious to know more about how that works.
They're being a bit secretive about their methods, which is understandable,
Of
but it does raise some interesting questions about the trade-offs between privacy and functionality.
Yeah.
If they're able to provide a high level of service without compromising patient data, that could be a game changer for the industry.
Absolutely. It sets a new standard for data privacy.
Right. And it shows that it's possible to develop AI solutions that are both powerful and privacy conscious.
Mm-hmm.
But most other companies do use patient data to train their models,
Okay.
which is why it's so important to have clear guidelines and regulations in place to ensure that data is handled responsibly.
Regulations, guidelines, those are all good things. But who's responsible for creating those? Is it the government, the medical boards, the tech companies themselves?
It's a complex issue, and it will likely involve a collaboration between all of those stakeholders. We're still in the early stages of figuring out how to best regulate AI in healthcare, but the conversation is happening, which is a good sign.
It's definitely a conversation that needs to be had.
Yeah.
We need to make sure that these powerful new tools are used ethically and responsibly with the best interests of patients at heart.
I completely agree. It's about finding that balance between innovation and patient protection.
So we've got these AI scribes shaking things up, making healthcare more efficient, more personalized, and hopefully more humane.
Right.
But as with any new technology, there are questions and concerns that need to be addressed.
Absolutely. It's important to approach this new era of healthcare with both excitement and a healthy dose of skepticism, asking questions and demanding transparency from the companies developing these technologies.
Right. It's not about blindly trusting AI. It's about using it as a tool to enhance healthcare and make it better for everyone.
Exactly. And that's why it's so important for patients to be informed and engaged in this conversation.
We'll be right back after a quick break to dive deeper into how AI scribes are actually being used in the real world.
Sounds good. It's a fascinating landscape, isn't it? So much potential for these AI scribes to really transform healthcare, not just for individual doctors and patients, but for the system as a whole.
Now that you mention it, we've all heard about the challenges facing healthcare these days, like long wait times and staffing shortages. I'm curious, could AI scribes play a role in addressing those issues?
It's definitely a possibility. If AI can help doctors be more efficient and see more patients in the same amount of time, it could potentially chip away at those long wait times. And if AI scribes can make the job of being a doctor a little bit less stressful, maybe it could help attract and retain more healthcare professionals, particularly in those underserved areas where the need is greatest.
Attracting more doctors and reducing wait times, those would be huge wins for patients. But let's be realistic here. Implementing new technology, especially in a field as complex as healthcare, can be expensive. I'm wondering, could the cost of these AI scribes be a barrier, especially for smaller practices or those in rural areas?
That's a valid concern. It's important to consider the financial side of things. The cost of AI scribes can vary, as we've seen with companies like Zabla and Nuance offering different price points. But what's often overlooked is the cost of not using these tools.
Oh, interesting.
Think about it, like doctors spending hours on paperwork instead of seeing patients' potential for errors that can lead to costly complications and the impact of burnout on the quality of care.
So it's not just about the sticker price of the technology, it's about weighing that against the potential savings in time, resources, and even improved patient outcomes.
Exactly. And as AI technology continues to develop and become more widely adopted, we can expect the costs to come down and accessibility to increase.
Okay.
It's similar to what we've seen with other technologies, smartphones, for example. What was once a luxury item is now practically indispensable for many people.
Yeah,
AI in healthcare could follow a similar trajectory.
that makes sense. And speaking of smartphones, didn't you mention that Apple is getting involved in this space? I'm curious to know more about their role, especially since they're not actually developing AI scribes themselves.
Right. Apple's approach is a bit different. They're not building the AI scribes, but they're focusing on empowering patients to access and control their own medical data through their health app.
Oh,
It's a really powerful tool that allows you to gather your health records from various providers and even track your own health data from wearable devices.
I've been using the health app to track my sleep, but I had no idea it could do all that. Sounds like it could be a game changer for patients having all that information at your fingertips.
hmm
But let's shift gears a bit and talk about the human side of this equation. I think a lot of people, myself included, might be wondering, won't doctors become too reliant on AI? Will they lose those essential human skills that are so important in healthcare?
It's a question that comes up a lot, and it's an important one to consider. But I think it's crucial to remember that AI is a tool, not a replacement for human doctors.
Right.
The goal of AI scribes is not to dehumanize healthcare, but to actually free up doctors to be more human, to focus on those aspects of care that require empathy, intuition, and genuine human connection.
So it's about augmenting their abilities, not replacing them.
Exactly. Think about it this way. Would you rather have a doctor who's exhausted, stressed, and buried in paperwork, or a doctor who's energized, focused, and fully present in the moment with you?
I think the answer is pretty clear.
Yeah.
We all want a doctor who's truly listening and engaged, not distracted by administrative tasks.
Right. And that's where AI scribes can make a real difference. They can help doctors reclaim that time and energy to focus on what matters most, building a strong relationship with their patients and providing compassionate, personalized care.
That makes a lot of sense. But what about the doctors themselves? Are they embracing this new technology, or is there some resistance to change? I mean, healthcare is a pretty traditional field, and I could see some doctors being hesitant to hand over some of their responsibilities to AI.
There's always going to be some resistance to change in any profession, especially one as deeply rooted in tradition as healthcare.
Right.
But I think what we're seeing is a growing recognition, particularly among younger generations of doctors, that AI can be a valuable tool to improve their workflows and help them provide better care.
So it's not just about making things easier for doctors, it's about making healthcare better for everyone.
Exactly. And it's not just individual doctors who are coming around to the idea of AI scribes. Medical organizations are also starting to provide guidance and even encouraging the adoption of these tools as a way to address issues like burnout and improve overall efficiency.
That's really encouraging to hear. It sounds like there's a real shift happening in the way we think about AI in healthcare.
There is. Organizations like the Canadian Medical Protective Association, for example, have issued guidelines on the use of AI scribes, emphasizing the importance of patient consent and data security.
So it's not just about throwing technology at the problem, it's about creating a framework for responsible and ethical use.
Precisely, we need to have clear guidelines, robust privacy protections, and ongoing monitoring to ensure that these tools are being used safely and ethically.
And that brings us back to the conversation about regulation. It's clear that we can't just rely on tech companies to self-regulate, right? The stakes are too high when it comes to healthcare.
Absolutely. We need strong government oversight to ensure that AI is being used in a way that benefits everyone, not just the companies developing these technologies. And historically, we've seen that regulation often lags behind innovation.
Right.
So it's crucial that we start having these conversations now before AI becomes so widespread that it's difficult to control.
So it's about being proactive, not reactive, anticipating potential problems and putting safeguards in place before they become major issues.
Exactly. And it's a conversation that needs to involve everyone, doctors, patients, policymakers, ethicists, and even the tech companies themselves.
Because ultimately, this is about shaping the future of healthcare, not just for ourselves, but for generations to come.
Absolutely. It's a responsibility we all share.
So we've talked a lot about the potential benefits for doctors and the healthcare system, but let's bring it back to you, the listener, the patient. How could AI scribes change your experience of healthcare? What are some of the ways it could improve your interactions with your doctor and the quality of care you receive?
Well, one of the most immediate benefits you might notice is a change in the doctor-patient dynamic during your appointments. Imagine walking into an exam room and your doctor is able to sit down with you, make eye contact, and genuinely listen to your concerns without being constantly distracted by their computer screen or a mountain of paperwork.
I've definitely had those appointments where I felt like the doctor was more focused on their computer than on me. It can feel really impersonal and frustrating.
Right, and that's where AI scribes can make a real difference. By taking over those administrative tasks, they can free up doctors to be more present and engaged with their patients.
So it's about bringing back that human connection that can sometimes feel lost in the hustle and bustle of modern healthcare.
Exactly. And it's not just about the doctor's attention. AI scribes can also help improve the quality of care you receive in several ways.
Okay.
For example, if your doctor is less stressed and burnt out, they're more likely to be attentive to your needs and make more informed decisions about your treatment.
That makes a lot of sense. A well-rested, focused doctor is going to be a better doctor overall.
Absolutely. And AI scribes can also play a role in chronic condition management, which affects a large portion of the population.
Okay.
Imagine a system where you can communicate with your doctor's AI assistant between appointments, get personalized reminders about medications or follow-up appointments, and even have your symptoms tracked and analyzed to identify potential problems before they become serious.
That sounds amazing. It would be like having a virtual health coach available 24/7. But what about the potential downsides? Are there any risks for patients that we need to be aware of?
There are always risks to consider with any new technology, especially in healthcare. We've already discussed the importance of data privacy, and that's something we need to remain vigilant about.
Right? We need to make sure that these AI systems are designed with patient privacy in mind and that there are strong safeguards in place to protect our sensitive health information.
Absolutely. And there's also the potential for errors.
Okay.
AI systems are still under development, and while they're getting better all the time, they're not perfect.
Right.
It's crucial for doctors to use their clinical judgment when interpreting AI-generated information and not blindly rely on it without careful consideration.
So it's about using AI as a tool to support decision-making, not as a replacement for human expertise.
Exactly. And as patients, we need to be aware of the limitations of AI and not hesitate to ask our doctors questions if something doesn't seem right or if we have concerns about how AI is being used in our care.
So it's about being informed and engaged,
Yeah.
not just passive recipients of AI-driven healthcare.
Right. It's a partnership, as we've been saying all along. A partnership between doctor and patient, between technology and human expertise, all working together to create a better healthcare experience for everyone.
And speaking of partnership, We were talking earlier about how Apple is empowering patients by giving them access to their own health data. I'm wondering, how does that tie into the bigger picture of AI and healthcare?
That's a great question. I think Apple's focus on patient empowerment is actually quite significant in the context of AI.
Okay.
When patients have access to their own health data, they're better equipped to have informed conversations with their doctors, ask the right questions, and advocate for their own needs. It shifts the power dynamic a bit, making healthcare more of a collaborative process.
I like that. It's about giving patients a voice and making them active participants in their own healthcare journeys.
Exactly, and I think that's a trend we're going to see continuing as AI becomes more integrated into healthcare. It's not just about automating tasks or improving efficiency. It's about creating a more patient-centered approach to care.
That's a great segue into our next topic.
Yeah.
We've talked a lot about the big picture of AI scribes, but now I'd love to get into some specific examples of companies that are already making waves in this field.
I think that would be really helpful. Let's dive into some real-world examples of how AI scribes are being used to improve healthcare, starting with a company that's been getting a lot of attention lately, Zabla.
Okay, we're back and ready to dive into some real-world examples of these AI scribes. You mentioned Nabla, and they've definitely piqued my curiosity, especially with their commitment to privacy.
Yeah, Nabla's approach is really fascinating. They're really focused on creating a seamless partnership between the doctor and the AI, where the AI does the heavy lifting of transcribing and organizing information,
Right.
but the doctor maintains complete control over the final notes.
So it's not about replacing the doctor's expertise, but about enhancing it, giving them a more efficient way to document patient encounters without sacrificing accuracy.
Exactly. And that seems to be a key selling point for many doctors. They want the benefits of AI,
Sure.
but they also want to maintain their professional autonomy.
And of course, there's that impressive claim of generating notes in just 20 seconds, which we talked about earlier. It still blows my mind how they manage that without missing crucial details.
Yeah, they're leveraging some really cutting-edge natural language processing and machine learning techniques to analyze the conversation in real time and extract the most relevant information. It's quite remarkable.
It makes you wonder what other tasks they could potentially automate in the future.
Yeah, the possibilities are pretty exciting. And beyond the speed and efficiency, their focus on privacy is also a major differentiator. In a world where data breaches are becoming increasingly common, Nabla's commitment to never storing user data is a game changer.
It definitely sets a high bar for the industry.
Yeah.
It shows that it's possible to develop AI solutions that are both powerful and privacy conscious.
Absolutely. But it's not just about privacy. Nabla is also pushing the boundaries of what's possible with asynchronous care, using AI to analyze patient chats and voice notes to provide insights and support, even when the doctor's office is closed.
So it's about extending the reach of healthcare beyond those traditional office visits.
Exactly. It's about meeting patients where they are using technology to bridge the gap between the digital world and the doctor's office.
Zabla is certainly a company to watch.
Yeah.
But they're not the only ones making waves in this space. What about Ambience? I'm intrigued by their focus on value-based care.
Yeah, Ambience is taking a very forward-thinking approach. Their focus on quality measures and RAF scores is all about helping doctors adapt to this new era of healthcare, where the emphasis is shifting from quantity to quality.
So it's about outcomes, not just outputs.
Precisely. Ambience is using AI to help doctors track those quality measures, improve outcomes, and ultimately provide more value to their patients.
It aligns perfectly with the shift we're seeing towards more personalized and preventative care. So we've got Nabla with their lightning-fast notes and commitment to privacy, and Ambience with their focus on value-based care. Are there other companies we should have on our radar?
We can't forget about the big guy in the room. Nuance, the maker of Dragon. Naturally speaking, they've been a leader in voice recognition technology for decades.
Dragon, naturally speaking, that brings back memories. I used to use that software back in college.
Yeah.
It was revolutionary at the time.
It really was. And Nuance has continued to innovate. Their DAX system is a very sophisticated AI scribe that integrates seamlessly with existing electronic health record systems, allowing doctors to dictate notes directly into their patients' charts.
It sounds incredibly efficient. But we mentioned earlier that Nuance is one of the pricier options on the market.
Right.
What are those extra dollars getting you?
For larger hospitals and healthcare systems, those extra features and the level of support that Nuance provides might be worth the investment. They have a proven track record and a deep understanding of the healthcare landscape.
So there's a range of options out there, from budget-friendly to more premium services, catering to different needs and budgets.
Exactly. And as the technology continues to evolve and competition heats up, we can expect to see even more innovation and hopefully more affordable options becoming available.
That's good news for everyone, both doctors and patients. We've talked a lot about specific companies, but let's zoom out for a moment and talk about the bigger picture. What does the future hold for AI medical scribes? Are they going to become the standard of care?
It's hard to predict the future with certainty, but I think it's safe to say that AI is going to play an increasingly important role in healthcare, and AI medical scribes are likely to be at the forefront of that transformation.
So we're just at the beginning of this journey.
Absolutely. And it's an exciting time to be witnessing these advancements, but as we move forward, it's crucial that we remain mindful of the ethical considerations and potential challenges that come with any new technology.
Right. It's not about replacing doctors with robots. It's about empowering them to provide better, more human-centered care.
Exactly. It's about using AI to enhance healthcare, not to dehumanize it. And it's up to all of us, doctors, patients, policymakers, to ensure that AI is used responsibly and ethically with the well-being of patients always at the forefront.
Well, I think this has been a truly insightful deep dive into the world of AI medical scribes. We've explored the technology, the potential benefits, the challenges, and even peered into the future of healthcare.
Yeah, it's been a fascinating conversation.
And I hope it's empowered our listeners to be more informed and engaged participants in their own healthcare journeys.
Me too.
We're all in this together, navigating this new era of healthcare.
Yeah.
And as always, we encourage you to stay curious, ask questions, and advocate for the kind of care you want to see in the world.
Couldn't agree more.
And we'll be back soon with more deep dives into the topics that matter to you.